Oh, I'll be brave if you're brave. I'll be brave, but only if you're brave. And it could be just you and me. We'll be family. Just wait and see. So I will fight if you'll fight. Yeah, I will fight, but only if you'll fight. Oh, we can make it through this like sailors in a tempest. Like sailors in a tempest together. And it could be just you and me. We'll be family. Just wait and see.
Good evening, everyone. Welcome to tonight's Lung Cancer Living Room. We're so excited to see all of you here in the room. It's a full house. People still coming in. Welcome, welcome. Welcome to all of you online who might be watching, hopefully from a cozy spot in your home, curled up somewhere, and ready for some exciting conversation. Just a couple of reminders before we get started. If you have your cell phones with you, please silent them. I always joke that I will call you out if your phone goes off, which is not really a joke because I will call you out. So please make sure to silence your phones. Also, there's some new people in the room, some of whom may or may not want to be on camera, which is totally fine. Nobody has to speak. It is not mandatory that you participate in a verbal way, so please don't feel like you have to. But we do start the meeting with an around the room, where we do invite patients to tell a little bit about themselves, who they are, and why they're here. One of the reasons I think that's so important is it really helps our guest speaker, who I'm going to introduce in a minute, know who their audience is, who they're talking to, so we can more better tailor the conversation to the needs. Also, I remember to everyone that this is Q&A throughout. We really want this to be interactive, so do not hesitate, do not worry that you're interrupting or answering a question that you think may or may not be relevant, because if it's relevant to you, it's certainly relevant to someone else. That goes for folks online too. I've got Jennifer Hughes, one of my colleagues over here on YouTube. Jennifer oversees our national event series. I've got my other colleague, Amy Moore, who is our Director of Science and Research on YouTube, as well as our Chief Strategy Officer, or on Facebook, sorry, as well as our Chief Strategy Officer on Facebook as well. That way they can, if you have questions, they're able to get those questions asked live for you. So without further ado, for those of you who don't know me, I am Danielle Hicks. My role here at the Foundation is to oversee anything and everything that really has a patient touch. So support, education, that sort of thing is my area of responsibility. I, of course, do not do it alone. We have an entire organization dedicated to patients and obviously other things, but patients are our priority. So that's who I am. I'm going to turn to the right. I'm going to end with an introduction of our panelists here on my left. That way you guys have it all fresh in your head who they are before we get talking. But I'm going to turn to my right and ask this lady here who she is.
I'm her mother. I'm just here to make sure she does a good job.
Oh, yeah, that's the story of my life.
No, I'm Bonnie, and I'm a patient like you. I've been a patient 15 years now, which is awesome, and committed myself in the Barco Lounger when I was having chemotherapy to change this disease. And we had some great news last week about lung cancer actually leading the way in research and everything else good. So, you know, all of our work respectively, is working. And more good news to come.
Thanks.
You're welcome.
Joanne. Oh, and don't forget to grab your mic so the people in TV land can hear you.
You usually start the other way.
I know. I tricked you this time.
Tricked ya.
My name is Joanne Berridge, and I was diagnosed in September of 2016 with non-small cell lung cancer, adenocarcinoma, EGFR exon 19 deletion, and I think that's all the alphabet soup. It was stage 4, metastasized to the left adrenal gland and bone. And this diagnosis came after a whole year of being shunted from specialist to specialist about a cough, and never having been given a chest X-ray or anything else to even check if there might be something worse than postnasal drip. Anyway, I was put on Tarceva right away, and that worked for 2 years. I had some mild side effects mostly, but I had an unusual one that my head got covered with scabs, which when they fell off took all my hair with it. So I was hairless for almost a year, but now it's back and in its natural color. So I say if I had to do it the hard way to get my hair back to natural color, that was the hard way to do it. Anyway, toward the end of the 2 years on Tarceva, I became part of a research project at Natera, which is a biomedical company locally headquartered here in San Carlos, actually, for a blood test to detect circulating tumor DNA. And in August, right before just the 2 years, I'd been on Tarceva 2 years, it showed that my blood test showed an uptick in circulating tumor DNA. My oncologist at UCSF, Dr. Blakely, had more blood drawn and sent for a Guardant test to determine what was in this circulating tumor DNA, and it did turn out to be T790M, which is one of the more common progressions of the EGFR when you're on Tarceva. And the targeted drug for that is Tagrisso. And so at just about the 2-year mark, I went on Tagrisso, and that happened to coincide with when Tagrisso was approved as first line for EGFR, which meant I would have been on Tagrisso from the beginning with a diagnosis today. So I've been on the Tagrisso for a year, and again, the circulating tumor DNA showed a little uptick about a month ago. And checking that, well, we did it twice. We did it again 2 months later to be sure that it wasn't just a blip, because it was a small uptick, and it was still inching up, or millimetering up, I guess I would call it. And so a CT scan did show that there might be something going on with my adrenal gland. Now, the blood test can see all of this as much as 11 months before a scan can. So because it looked as if something might be going on with the adrenal gland, they did a PET scan, and sure enough, it was showing some metabolic activity. And that's the only spot. So I was referred for stereotactical radiation, which I have had the markers placed. I've had my little they make you kind of a cocoon so you can't move. That's been made, and I start.
Well, they heard about you, so they have to keep you silent. I said they all heard about how much you move around. So yeah, it's only you.
That's why. Well, they even measure how you breathe, so they can get this stereotactical radiation in exactly the right place. And I will have 5 sessions of 20 minutes starting tomorrow of that, and don't expect any other complications.
Speaking of early detection, right?
Yes.
Yeah.
I'm Ron, the husband, and I am here listening and learning.
Thanks, Ron. I think Don's got one, yeah.
Good evening. My name is Don Stranathan, and I'm a stage 4 lung cancer survivor, adenocarcinoma. I was diagnosed in June of 2009, so I'm coming up on 10 and a half years, or actually I'm at 10 and a half years with stage 4. And I would go into my treatment history, but it would take the rest of probably the hour. I've been on every probably FDA-approved medication for non-small cell lung cancer, and I'm going back to my second round of some of them. I was looking at getting into a clinical trial at UC Davis, but I didn't qualify for the arm that I was trying to get into because I've had like over 5 different immunotherapies, and they were looking for patients that were on their first line of immunotherapy. So, and at the time, I had to have a brain MRI to verify that I didn't have lesions in my brain, and it showed up 12 lesions. So I started with CyberKnife. I had 3 sessions of CyberKnife, and it took care of it, and those lesions are doing fairly well. But there was 6 small new ones, and there was a few that looked like they had leptomeningeal involvement. So my radiation oncologist at Kaiser in San Francisco suggested that I would be better off doing whole brain radiation. It would be more comprehensive. So I'm doing whole brain radiation right now. I'm getting 10 sessions of whole brain radiation, and I'm getting, I had the left side of my neck done for my lymph nodes, and I'm getting it, this time I'm getting whole brain, and I'm getting the right side of my neck done. And I finished that on Thursday, and then I start a new combination. It was a clinical trial number was IMpower 150. So I'll be starting immunotherapy, Tecentriq, Avastin, which is an antibody drug conjugate, and 2 chemo drugs, Taxol and Carbo. So I finish radiation on Thursday and start those on Friday. So anyway, that's where I'm at right now. Thank you.
Thanks, Don.
Thanks, Dawn.
Hi, Tim.
Hi, I'm Tim. I was diagnosed with stage 3B non-small cell lung cancer in August of 2019. So this won't take me very long. And I'm not unfamiliar with the disease. I've been hanging around this guy for 10 years, and then I was diagnosed last year. He'd been trying to tell me to get in. I could have caught it even earlier, possibly. Another point for early detection, right? So I did chemotherapy and radiation together for the first 6 weeks, and I showed 70% reduction in tumor size. And then they moved me to Imfinzi, which I'm on now. And I really believe that it's working. I have a scan coming up on Friday, a PET scan. So I almost know that it's going to be another good scan for me. I really do. I feel better. My voice is starting to come back. And I love it here. I really do. I get filled up every time with hope, every time I come down here with Dawn. And, in every tough diagnosis like this, there are blessings that I've met just some of the most wonderful people I would have never met otherwise since diagnosis. And it took a while to start seeing those things, but they are there if you look for them. But thank you.
Thanks, Tim.
Hi, my name is Tina, and I've been at this for almost 10 years, so that's the good news. But also, the other good news is it was so easy. I have not had any recurrence in that time, so my initial diagnosis, my best shot was chemo and radiation. And even though I was tested positive for EGFR, they did do that 10 years ago, so that's pretty good.
Yeah.
So I did do the chemo and radiation, and then after that treatment, my scans were clear, and my doctor felt that I should take Tarceva, just more or less a maintenance thing, and I'm still taking Tarceva. It's working. My scans have been clean ever since. So,
Yay.
yay.
Thanks, Tina.
Hi, I'm Sally, and I was at great risk for getting lung cancer. My mother had it 3 times, and she lived 22 years, though, from start to finish. And her brother had it, and my paternal grandfather, and I had been a smoker, but I had quit quite a while ago. And I found out about the International Early Lung Cancer I always forget what ILCAP. And I got to get into that, and they were trying to find people with, if they could find lung cancer sooner with the low-dose CAT scan than with X-ray. And after they found nodules in all my lobes, but figured that might be scar tissue, and I'd had pneumonia before, and whatever. And then after about 5 years in the study, one grew, and I had surgery. It was diagnosed in February. It'll be 11 years. And I had surgery in March. And so I've been cancer-free since then, but I am watched because of the family history and because of the other nodules that I have. So I get yearly scans now.
Thanks, Sally.
Thanks, Sally.
Before we move, just because Sally talked about screening and entering herself into the ILCAP study, and Tim touched on the fact that he may have qualified for screening and just hadn't done it, and maybe it could have been found earlier. We always like to bring up at the living rooms screening when it comes up, and although it's not relevant to those of you in the room who have already been diagnosed with lung cancer, it could be very relevant to somebody you know that qualifies. So I challenge all of you watching between now and the next living room to have that conversation with at least one person, because you could make a huge, huge difference in their life. Even if it's not meaningful to them, it could be meaningful to someone that they know. And we can go over what the qualifying criteria are again. We've got pamphlets on it in the room on your way out. But basically, if you know someone over 55 who has a 30-pack year history, so either they smoked a pack a day for 30 years and/or 2 packs a day for 15, and so on, and they've quit within the last 15 years, they pretty much qualify for screening. So it's a huge, huge, huge positive in someone's life, and something that is easy for all of us to do. So,
And you and your sister are in a program, right?
we've already started being screened, even though we don't qualify.
Right. But no, you do.
I'm not old enough. First of all, let's just start there. I've got 5 years to go.
She's in Chinoon.
And I'm the oldest daughter. I'm still not old enough. Anyway.
But she and Andrea have tested twice now, right? Mm-hmm. Yeah. So.
This is on. Hi, everyone. I'm Casey. It's nice to see a lot of familiar faces tonight and a lot of new ones. I have not been back or involved for about a year now. Lung cancer first entered my life at 21 when my college roommate at Cal was diagnosed with stage 4 lung cancer. As a young, healthy student athlete, it was very surprising, and so Jill Costello got involved in what was then the Bonnie J. Adario Lung Cancer Foundation, and she brought us under her wing, and with her we started a group focused on adolescent young adult lung cancer. For part-time, while I was also traveling the world as a skier, I was working part-time as the director of Jill's Legacy, helping launch the genomics of young lung cancer, and really starting the work for a population of lung cancer patients and survivors that had not really, been thought of age 15 to 39. So, life takes you in different directions. I got pretty busy with another job, but I'm so happy to be back here. And as everyone has kind of said, this is a family, and it's always a family, so I'm happy to be back here tonight.
Thanks, Casey.
We love you, Casey.
Hi, I'm Larry. I was diagnosed with stage 4 non-small cell adenocarcinoma with EGFR mutation, exon 19, deletion, and that will be 7 years ago next week. And so I've had 3 systemic protocols. First had chemo and responded well to that. Then I progressed and started on targeted therapy drug to Tarceva, and was on it for 2 years and progressed. And now I'm on Tagrisso, and I've been on it for over 3 years. My last scans were no metabolic activity. And I've been doing the same blood test that Joanne's doing, the Signatera, looking for circulating tumor DNA. And I've had 3 blood draws, and they all show no circulating tumor DNA. So I'm just happy to be in the living room. I'm always happy to be in the living room.
We're happy to have you.
Thanks, Larry.
Hi, my name is Rick Meyer. I was diagnosed in November of 14, stage 4 lung cancer. Started out with crizotinib for 19 months. I'm ALK positive. So started with crizotinib, which is really good on ALK, but unfortunately it doesn't work in the brain. Ended up with a brain MRI showing 3 metastases, so I switched over to a trial drug, X396. Was on that for 2.5 years. While on that drug, we had slight progression. New spots would pop up, all very small, not particularly troublesome, non-symptomatic. In 2017, I did CyberKnife on a couple of spots that seemed more troublesome than others. Continued taking meds, went on alectinib for about 6 months. Had horrible results on that drug, unfortunately. Works well for most, so don't be scared. Give it a shot. After that, went on brigatinib. I've been on that now for a little over 6 months. This morning, I went in for CyberKnife, hit 3 more spots. So this is an example of how you can be the day of CyberKnife. Really not that scary. Modern technology is just absolutely incredible. And I can't say enough about the people involved in this group and all the doctors and caregivers, what they do to make our lives better. So I'd just like to give a big shout out to them. Thanks.
Thanks, Rick.
Hi, I'm Rick Bryson. I was diagnosed February of 2015 with stage 4 adenocarcinoma. I did not have any of the genetic mutations, so I was a prime candidate for old school chemo. I started with carboplatin and Alimta and did that for 4 cycles, and then I was on Alimta only for maintenance. During that time, I had progression on my adrenal gland. But since the carboplatin did such a good job on my lung tumor and my lymph nodes, I was able to have my adrenal gland surgically removed. And then I went back on chemo just for 3 months or so. And in February of 2016, I had my first clean scan, and I've been NED, no evidence of disease, ever since for like 3.5 years or so. I did have one complication. A year after I ended chemo, I had ended up getting a blood clot because I was taking Lovenox for clotting during chemo, and when I stopped taking the Lovenox, then it just started building up again. So keep in tune with your body as you go through this, and always bring something up to your docs when things don't seem like they're right. But I retired during my treatment, and right now I'm filling my days with volunteering and walking the dog. So, good to be here.
Thanks, Rick.
My name is Jennifer, and I was diagnosed in August of 2018 with stage 4 non-small cell lung cancer. I had mets to the brain, 3 mets. I had it in my spine, my hip, my adrenal gland. And after radiation, I only had to have 2 sessions of radiation in my head and a couple in my neck. My adrenal gland, everything's cleared up except for my lung. I started out on cisplatin, Alimta, and Keytruda, and have been on maintenance since December of 2018 on Alimta and Keytruda. And my scans have been stable the entire time, so I haven't had any issues. I was able to skip a couple of treatments over the holidays just this last year, and that felt great because you always wonder if the cancer's going to take you or the chemo's going to take you sometimes. So it's nice to give your body a chance.
So you did that all by yourself?
To
You just
detox.
decided to do a little clinical trial?
A little bit, yeah.
Okay.
And the doctor, we had a discussion, and he felt that it was, because I've been so stable, he said it was a good idea. And so I feel great and have scans again next month, but I started back in treatment after the holidays, and so far so good. And my husband takes great care of me. He's my juicer every morning, makes my healing tea for me. So he's
Good to have a
does a
juicer in
great
the
job,
family.
yes. And I love coming here every month and leaving with such hope and meeting everybody. It's a wonderful feeling. And thank you for everything you do.
Thanks, Jennifer.
Okay.
Uh-oh.
Turned on?
Whose phone? Whose phone?
Karen.
Oh, Karen.
Hi, my name's Robert. I was diagnosed with stage 4 non-small cell in May of 2014. And the typical treatment stuff. I'm doing very well. I have some residual bone damage in my spine, which caused a lot of pain, but nothing you can't deal with. I'm here tonight with my friend Don. His first time. He was recently diagnosed, so maybe he wants to share his story.
Yeah, Don Horsley. I in my I guess the 3rd week of Tagrisso, so I just was diagnosed only a couple of months ago, and it's stage 4 cancer, and I couldn't believe it because I have never smoked, and in any case, I am EGFR, and so far I've just tolerated the Tagrisso pretty well, and I don't know as much about it. In fact, in some ways, I probably I'm still at that stage where there isn't a day goes by where I don't sort of have all the anxiety worrying about it. I still work, and I am a county supervisor, and that's a good thing about that is that when I am doing what I do at work, I can forget about it, and some of my dear friends can make me laugh. So I decided that I actually haven't told a whole lot of people because I don't like explaining how it came about. How I discovered was I had a cold after we came back from a trip to Ireland. And I couldn't get rid of this cold. I went into the doctor and said, I don't understand why this cold's hanging on and on. And that's when they did an X-ray and found it. And then I've gone through, you name all the tests that everybody else has gone through, PET scans and CT scans and MRIs and et cetera. And it was pretty shocking. So my dear friend Robert here, suggested he would take me here and hold my hand. Thank you, Robert.
You're welcome.
And you got all dressed up. That's awesome.
Well, we are glad, Don.
Yeah, right.
To have you. Happy that you're here. This is as you've heard, with the around the rooms, lots of different experiences, but also lots of hope and lots of support. So, welcome. We're happy to have you.
The great thing about being here,
Yeah.
the great thing about being here, with Don, he can hear other people's stories and who has which treatment for the different stuff, and it gives him someone to talk to and hey, what happened when you did that, and
Right.
so on. I mean, everybody knows what it's like.
Yeah.
Right.
Yeah. Thanks.
Somebody asked me recently, it's like, how do you get so many men come to your support group? And I said, well, it's because it's not just a support group. It's an educational group. It's live streamed all over the world. We have a purpose here, and the purpose is long life, for as many people as we can help get that. And men don't usually go to things like this. And I'm just so pleased that you're so comfortable, being here, right? It's a good thing.
It's very
really
true,
a
and I
good
think
thing.
it's a really good point, because statistically
Right.
speaking, you're right, men do
Yeah.
not participate. But this isn't your traditional support.
Right. It's,
like you
it's
said.
not what you,
Yeah.
you have to come here to get it,
Yeah.
right? And then you come and you don't go. And that's good. That's awesome.
Hi, my name is Sapna. I'm actually not a patient. I work at Genentech, and I'm just here to hear the patient journey and get some insights as we work to improve the way we design our clinical trials and see if there's something that we can take back. I'm here with my colleague to just make things a little bit easier for you guys. So thank you for having us.
I'm the colleague. My name is Salah, and really it's all about trying to improve your experience on clinical trials. And for us, it's mainly on the clinical trials, but anywhere else that we can help and send back a message for you, please let us know. Thank you.
Hi, my name is Ron, and I am wearing red today because it's Chinese New Year's on Saturday.
Yay!
So go out, patronize your Chinese restaurants, make business happen, make it prosperous. Long life, all that good stuff, prosperity. So you have a chance to do your New Year's resolution all over again. My wife was diagnosed with lung cancer, stage 4, EGFR mutant, by accident. It was discovered by accident. And so if you have a symptom, you ought to go make sure that you talk to your doctor. Don't just tough it out, because it can be, it might be, or it might not. But let the docs figure it out, because they're smarter than we are. I'm also here to tell you that as a lung cancer advocate at this point that the Women and Lung Cancer Research and Preventative Service Act is still happening in Congress. So if you know somebody, or even if you don't know somebody in Congress, write them anyway. Get their mind off the current business of the day that's happening in dominating news, and tell them, take a break. Have your elective congressman or congresswoman or senator support this act, the Woman and Lung Cancer Research Act, and Prevention Act, because it's an important thing. We don't have enough research dollars in lung cancer, and we don't have enough knowledge of why is it that the rate of women getting lung cancer in the last decade doubled. Why is it that the woman...
It's going up in women and going down in men. Yay, going down in men. But, we want it going down in everybody.
We want it going down in everybody, but why is it that women have an incidence of lung cancer differently than men? Why is it that the younger people who never smoked have lung cancer more? And they don't know because there's no research. So this bill is going to help figure out a little bit better why that's happening, but they can't do it unless your senators vote for it. Senator Feinstein's sponsor, she's Democrat. Senator Rubio from Florida is a Republican. It's bipartisan. How could we lose? Unlike other things that are happening. So let's get them to do something bipartisan, and that would help a lot of people, because so many people are impacted by lung cancer in America and around the world. So thank you.
Thank you, Ron.
Thanks, Ron.
My name is Fred Palmer, and I was diagnosed with non-small cell lung cancer in October of 2013. I was on immunotherapy up to September of 2018. I haven't had any treatment since, and I've been involved in the Signatera study for blood biopsies targeting the specific genetic makeup of an individual's tumor. And the clinical trial is now over, and all 3 of my tests were negative.
Yay, that's awesome.
Thanks, Fred.
Good stuff, good news.
Hi, my name is Wayne. My wife Rebecca is here, and her mother Nellie, and Rebecca's... And her daughter. Oh, our dog.
And your daughter.
And Rebecca's got stage 4 mucinous adenocarcinoma. She's got KRAS G12D, no PD-L1 expression, and she's not been a smoker. Got some good news. We had a CT and an MRI just this afternoon, and they both turned out great. And just a little background on her treatment history. She started with chemoradiation, followed by durvalumab per the Pacific trial, progressed after about 4 months, and then went on carboplatin and Avastin and stayed on maintenance for about a year. Then she participated in a clinical trial at UC Davis involving Keytruda and trametinib, and that trial didn't go very well. It didn't work, and she had horrible side effects. That
The
last,
trial was good.
but the trial was good.
But the experience and participating in the trial was
Yeah,
wonderful.
it was well designed. It didn't work out for us. It lasted about 6 weeks, and since October, she's been on gemcitabine
And doing great.
and doing great, and
Recovering.
stable scan today. So good news.
That's great. That's great. Great. Great news.
Good afternoon. My name is Jane Canalao, and I am a patient of Dr. Donald Abrams. I'm here because he gave me a flyer when I visited him. Said, "You come to my talk in San Carlos," you know. And I was accidentally. It just happened that I was having vertigo, September 2016. I am one who never had symptoms for lung cancer, never had shortness of breath, and never had any of this other symptom like there's two that my doctor mentioned: shortness of breath and coughing that wouldn't go away. None of those. So in September 2016, I had vertigo, and then I didn't know why, So I told my doctor. My primary care was in Tracy at that time because I live in Patterson. And then she ordered some EKGs, and she said, "Oh, you have a lot of PVCs. I'm going to refer you to your cardiologist." So I was on a Holter monitor for 24 hours, and my cardiologist said, "You have a lot of PVCs. I'll refer you to an electrophysiologist in Stockton." And then when I went there, he said, "I think I know where it's malfunctioning electrically in your heart, but I need to go through your veins, and then while it's malfunctioning, I'll zap it." It was like a radio frequency because there's two types. There's the cryo and the radio frequency. So I said, "What's the success rate?" "It's about 93 to 95. Go for it," I told him. So they scheduled me for December 19, 2016. And on December 12, they called me to have my pre-op. So I had chest X-ray, I had lab work and EKG. Lo and behold, 2 days later, Wednesday, the nurse of my electrophysiologist called and said, "We want to talk to your primary care. We found something in your chest X-ray." And I said, "Okay, send everything this afternoon," because I just came from her office, and to talk about what the electrophysiologist had found and what procedure I was going to get. I said, "I'll call them right now and I'll see them the next day." So they faxed everything to her. The next day I went to my primary care and she said, "Yeah, it's very, very suspicious. It's huge, but it's only a chest X-ray." So she scheduled a chest scan without contrast at the Tracy Hospital because I have allergies to iodine contrast. So, but it was enough where she saw the big thing, and then she asked for also a brain MRI, and nothing was wrong with the brain, thank God. And so on December 28th, she scheduled for me to see her, and she said, "Your chest CT scan showed that you really have cancer. At what stage, we don't know. I will refer you to a pulmonologist." And I told her, "I want to go to Stanford." And then she said, "Are you sure?" Because the pulmonologist in Tracy is on vacation, but you can see a pulmonologist in Stockton tomorrow right away. "I want to go to Stanford," I told her. "You think you're going to wait? How long should I wait?" She said, "Oh, maybe a month, 2 months, 3 months, I don't know." "I want to go to Stanford." She said, "Make up your mind now, because I don't want you to be saying, okay, take me to Stockton. I want to see the doctor right away. Then you say, I want a second opinion. I want to go to Stanford, I told her. So that afternoon, she wrote a letter to expedite everything, priority. She sent it to Stanford. In a week, Stanford Pulmonology Clinic called me, January 6th of 2017. They said, we want to schedule an appointment with you. January 2011. But I prayed so hard to God. I said, please, let them see me right away. And he heard it. And so 2011, January, I had my first appointment with my pulmonologist, and she scheduled a biopsy. And it was I had 2 biopsies. She did the bronchoscopically, but it wasn't able to go all the way up. So she scheduled another one where they do it here. And then it was positive for lung cancer. And she said, your cancer is all contained in your right lung upper lobe, and it's this big. So she called the nurse coordinator, said, I want all these things. This was February 2 when she told us, and she showed us my sister and my husband was with me at that time. And then she said, she told the 2 biopsies I had was January 17, January 25. So this was February 2. She told the nurse coordinator, I want all these things to happen tomorrow. A PET scan, a brain MRI, and a schedule to see her, a thoracic oncology surgeon. So the nurse coordinator came back. I could get the brain scan tomorrow, the brain MRI tomorrow. She has a schedule to see the Dr. Schrager, the thoracic oncology surgeon, February 7, but I can't have the PET scan till February 9. She said, okay, keep that, but keep working on it. So we go home, and then we went to my daughter's, and then lo and behold, the nurse coordinator called. This is your schedule tomorrow. You go to PET scan at 9 o'clock, do not eat for so many hours. And then at 12 noon, and the PFT, the pulmonary function test, was also there. Go to your brain MRI, at 6 p.m. in Redwood City. And then your pulmonary function test is at 3 p.m. Everything happened the next day. And then I saw my thoracic oncology surgeon. When we saw the thoracic oncology surgeon, he said, although the radiologist didn't call it, I saw some activity in your lymph nodes, 1 lymph node. So she said, he's going to remove my whole life. Are you going to remove that 1 lymph node? He said, no, I'm removing all 11 lymph nodes. Mm-hmm. I said, okay. So I went to surgery, and then 6 weeks later, I saw the oncologist, Dr. Neil. He put me on 3 courses of infused chemo, Alimta, and cisplatin. Unfortunately, on my 3rd chemo, May 12, 2017, I had fluid overload, and it gave me heart failure. And 6 months later, then they stopped the 4th chemo and put me on Tarceva, which is supposed to be a 2-year program. And just like what the patient there, I had also scabs from head to toe, all rashes, yes, with Tarceva. And they wanted to stop it because my rashes was horrible. And I said, no, Tarceva is the only treatment I have. He said, okay. But in March 2018, the Tarceva gave me an anaphylactic allergic reaction. So my oncologist, Dr. Neil, said, Jane, we need to stop this. This can kill you. So I had no treatment, and in August 2018, my cancer came back. It's in my right lung middle lobe and right lung lower lobe. So it kept growing. It's still small, and that's when I found Dr. Donald Abrams. I told the librarian because I did realize that I have very little option for treatment. I don't have a lot of option. So I said, I better become proactive. So I told the librarian, and I said, help me find an integrative medical oncologist in the Bay Area. Because everything I'm finding was in Arizona, in LA, and I said, she found Dr. Donald Abrams. And I saw Dr. Donald Abrams in March of 2019 and July 2019. My oncologist started me on gefitinib, which does not cause heart failure. It's a pill, on July 6. And after 6 weeks, he ordered a CT scan. And lo and behold, after 6 weeks on gefitinib, it reduced in size and depth. It was reducing my pore nodules. And the biggest nodule at that time was about 10 millimeter by 6. And he said, I could start you on the, we continue. But unfortunately, on October 18, I went to my cutaneous oncologist for my rashes. And I said, I can't breathe. And it's not going away. Even though I'm on a as-needed Lasix, it wouldn't go away, my shortness of breath. So I went to the walk-in clinic, and then the walk-in clinic at Stanford, and she told me, you go to the ER because your oxygen level is going down and your blood pressure is going down. They thought I had blood clot, but I had no blood clot. They also no blood clot in my legs. But the chest CT scan with contrast showed that the gefitinib is drug-induced lung inflammation, both lungs. And the first scan I had on October 20, you could even see my lungs. It was like a dark, smoky white cloud. But in November 8, we did another scan, and I was put on prednisone, and the prednisone, and also an insulin because it was shooting up my blood sugar. I was in Stanford for 9 days, and when they released me, that's it. I have no treatment. I cannot have any treatment. In December 20, I saw Dr. Neil, and he said my cancer is growing again. The 7 millimeter is now 10 again by 7, and that's the biggest one. He said, Jane, the other chemo pills will cause you heart failure. And if I treat you right now, you will die in 6 months to a year because you have 4 serious side effects, 3 of whom can kill you. Heart failure, kidney failure, stage 3, and the lung inflammation. The 4th one are the rashes. So he said, but your cancer is still so small, and it will be, it's slow growing. If we just leave it like that, you have years. I said, how many years? He said, I don't know yet at this point. He said, but I have patients who's been going through this, and 2 years later, they're still here. And Connie Lee, the nurse that's seeing me every month from Dr. Neil's office, told me last Friday, some of you are still here 5 years later. So I'm hoping that, there will be some miracle. We could find some treatment between now and 2 years later, and I'm going to still be here.
Yeah.
And I'm a very, very positive person, and I always dwell on the positivity, and I pray a lot. And I feel like I can beat this, So that's my story.
Jane, I have to tell you, thank you so much for telling your story. We're thrilled
And I'm so happy that I'm here. This is my first time.
We're very
and I brought
happy
my sister.
to
My
have you.
sister, she was the one that I lived with the first time they found my cancer. She was living but she already moved to Washington, D.C. and then now Dubai. Her husband is a legal attaché at the embassy in Dubai.
Right.
She's only here because we had our 55-year-old sister-in-law passed away. She had a cardiac arrest on December 31st. And she never gained consciousness, so she just died.
I'm so sorry to hear that, but we're happy you guys are here.
So she's going to all of my appointments and
That's great.
giving me support again, like at you.
That's great.
She's
Dr.
the
Neil,
youngest, and I'm the oldest.
Dr. Neil just spoke here in August.
Oh,
He was our speaker in August. Yeah. Happy to have you. Happy to have you.
so
Thanks for
much,
coming.
And I'm happy, Dr. Dom.
We are too. We're anxious to get to it.
It's close.
Hi, my name is Mary Joy. As you guys can see, you're here. My sister's Rain Woman. She remembers all the dates, times, and everything. But thank you for the work you do. Really appreciate it. Bless you all for everything, for the teaching,
Thank
the
you.
education, for the hope that you give to each and every one of them here. Thank you.
Thank you. Hi, Evangeline.
Good evening. My name is Evangeline, and I've been coming here since August of 2018, and I'm very grateful that I found this family.
They will, but we can ask them.
I was diagnosed with non-small cell lung cancer, adenocarcinoma, on March. I was diagnosed March 2017. non-small cell lung cancer, adenocarcinoma, stage 4, and I'm EGFR positive. So, but since my cancer metastasized to my head, one in the right brain and one in the left bone of the skull, my oncologist recommended me to have cyberknife radiation on my right brain, which helped it decrease by a little bit of like 2 millimeters. And then I started immediately with Tarceva, May of 2017, for 19 months. And so March of last year, I had another biopsy, and they put me on Tagrisso since April of last year until present. They've monitored me every 3 months. The first one, after I started April, they monitored, I had an MRI and CAT scan, and I believe the Tagrisso worked because the tumor on my right brain has decreased in size, as well as the tumor on my upper left lobe. Then after 3 months, I had another MRI and CAT scan, October. Everything's stable, no signs of metastasis. And then last week, I have MRI and CAT scan again, and I don't know the result yet till Friday. So everything's fine and under control, and I'm grateful God is with me on this journey. Thank you.
Hi, I'm Pat Pritchard, and I was diagnosed November of 18, and have been, it's non-small cell adenocarcinoma with BRAF negative on the left and BRAF positive on the right. I want to say welcome to Don Horsley. I worked in the Hall of Justice for quite a while, and there was such a rash of cancer diagnoses at the time that the probation officers all talked about filing suit because of the dirty guana intake air valves and all different problems. Anyway, with chronic bronchitis, allergies, and asthma, the regular medications weren't working for me, so they did x-rays and said, oh, whoops, that spot we thought was an infection has now grown. So that's how they discovered it. I'm being treated with CyberKnife, and my next photo shoot is next week, and then I'll have Scanxiety double what I have now for another week till I get the results. And all I can do is be positive. I was stage 1, and I really appreciate everybody who's talked about being stage 4 and 6 years ago. And my God, it's like I can't give up. I've got to keep hiking and doing volunteering and doing all the good stuff. Thank you.
Thank you, Pat.
Hi, good evening. I'm Candy. I'm Evangeline's friend. We both have cancer, but mine is not in the lungs, but it's stage 4, the same. We support each other in this journey together. So she invites me to come here all the time. So I support her. She supports me in my journey too. So thank you.
Welcome, Candy.
Anytime.
Hi, I'm Jason Rand. My relationship with this organization is because of my mom, Stephanie. She was diagnosed in November of 2016, and she lost her battle in May of 2018. And I wanted to do something really positive as a result of everything she went through. And we are from the Bay Area, and it was nice that I had the time to be with her. She was getting treatment at UCSF. She was seeing Dr. Jahan, who I have only wonderful things to say. And so I decided to fundraise for the organization, and I fundraised for the New York City Marathon, which I actually wanted to run for about 8 years. So it was wonderful to fundraise and run it in November, and I raised about $400, I think. Not exactly counting, but it was a nice way to celebrate and honor my mom, and I'm appreciative of the time that I had with her. She was on a couple of different treatments, and she was well enough at one point that I got to take her on a trip to Europe, and we just had a great time. And so out of her diagnosis, I just trying to see the positive of it all. And I'm at a better place now, I think, because the last couple of times I think I broke down coming here. And life goes on, but you can honor and remember the people that matter most. And this is part of my story now, too, and remembering my mom.
Thanks, Jason.
Hi.
Hi.
My name is Karen Withrow. I apologize for the phone. I truly thought it was off. That's what you get when you think and don't look.
You're in trouble.
I am actually, as of this month, a 12-year survivor. I was an accidental finding, and I was very, very fortunate because I was stage 1B. So the protocol then was to immediately do surgery, and then after a lot of discussion after surgery, whether I had treatment or not, I did opt to have treatment as an insurance plan. So I had cisplatin and gemcitabine for 4 months. And I've done well since, and I'm grateful, and I'm so, so grateful for this organization. I didn't know it back in those days. I wish I had, but I love it, and I always want to do all I can. Thank you.
Thanks, Karen.
Thank you, Karen.
I'm Virginia. I'm new. First night here. Thank you, Susan, for inviting me. Bonnie, you're unbelievable. Thank you for everything that you do. Read your book, and it was the first organization I kind of reached out to when I found out about my diagnosis for lung cancer. And I just have to say, you know, yes, I have cancer, and I was diagnosed in 2018, but boy, I sit in this room and I hear you, all of you your stories are just so glorious and so beautiful and sharing and kind. You kind of just like, yeah, like we're going to do this together, and it really is together. So anyway, but just I'm not going to talk long because there's a lot of other people here. But I was diagnosed in 2018 July, and EGFR. I went into targeted therapy, had surgery, removal of my left lung, and I'm doing really well. No side effects from the drug. I am on my way to run a marathon in San Francisco to raise money. And so I'm just like, this is so touching to me. I'm just, okay, I'm going to move on.
Keep talking. It's okay.
Thanks, Virginia.
Thank you so much.
It's up to you. You don't have to. Over here.
Hi, everybody. My name is Emily. I work at GoTo Foundation with Danielle and my fellow colleagues here, and I just want to share that my mom is a 2-time 20-year survivor and going strong, NED. So I hear you all. I've been on that journey with my mom, so thank you for sharing your stories, and thank you for inspiring me and all my colleagues here for telling us to keep up the good fight. We will. We always will. So thank you all so much.
No, wait, Lori, you're not going to get away with this. No, get the mic, Missy. This is
really
my
have to get to
partner, you know, in our merger with Lung Cancer Alliance, and this is Lori Fenton, and you're not going to not get away with talking.
I will be very brief, and Bonnie will be so grateful.
That will
She's
be
like,
awesome.
great, she's not going to talk a lot. Yes, I am Bonnie's co-founder of GoTo Foundation, and I am so humbled and so proud to be a part of this extraordinary endeavor, and knowing that being here in this living room is what inspires all of us. I am just always so touched. It reinforces the why and the how and the need, just being together and knowing that we're going to accomplish this, and we will do it because we are all in this. And Bonnie, just love you. But this is just a very special time for me, but for our community, because we're going to see great things happen together. So thank you.
Thanks, Lori. These ladies flew in this morning from our DC office, so They have to be a little jet lagged too. So much efficient. Yeah.
And you know, our merger really has made this a nationwide organization, and you know, we can't be happier with how we have pulled together, worked together, loved together, and are really focused on you. Period. Patients first, always.
Yeah.
Hi, good evening, everybody. Hello, great to see you again. Barney, I missed you twice,
I love
right?
you.
All right. My name is Renlang. Let me start with as a cancer patient, there's a lot that I feel bad and negative, but every month when it's time to come to here for the living room, somehow I always feel great. And a couple of days before that, I start to, expecting the event and I try to come. On the way here, I always feel excited. I try to figure out why. I think that the main reason too, probably more, to see the face that I like to see all those friends, all those fighters, and their amazing stories always inspire me. And of course, all the new technology and the doctors and the featured speakers and give us a lot of information. And I really appreciate that for the organization. Great for what you do, and thank you so much. My story started from 2014. About in springtime, I started to feel like when I lie in bed, I can feel my heart pounding. And I don't really need it to get to my pulse to know what's my heart rate. So I don't know, I don't feel uncomfortable, but it's just to feel like why I can feel my heart pounding. So I went to see my family doctor, and he doesn't have a good explanation, and he did ultrasound. He, like I said, do an ultrasound to see anything wrong with the heart. So ultrasound turns out there's nothing wrong with my heart. But after a while, I start to develop some kind of coughing, and it's persistent, and it's been lasting for a couple of months. And eventually, I did X-ray, in which figured there's a big mass on my left lung, about 5 times 3 centimeter. So from that point on, I went through all the procedures as everybody went through. I was with Dr. Neil in Stanford. I went through 3 rounds of chemo with cisplanting as the main agent to cure me. So after 3 rounds of chemo, my tumor shrank about 40%. At which point, Dr. Schwega, who is the surgeon, took me for operation. So in February 2015, I went through the left lung pneumonectomy. Ever since, I've been doing CT scan, check every half year for 2 years, then every year for the last 2 years. So this April, that will be my 5th year of checking. So far, I'm still NED, and have my finger crossed. And again, so there's a lot of a price paid to go through this treatment. Let me just mention a few. The cisplanting treatment, I think, basically hurt my hearing a lot. So after that, I lost my hearing, about 50% of my hearing loss. And there's some damage to my kidney function right after that as well. But gradually for the past few years, my kidney benchmark started getting back into the normal range. There's another price paid, which is my blood benchmark. The neutrophil is kind of below the low end of the normal range. And I've been asking Dr. Neil and my family doctor, they don't have a good explanation. Some assumption would be that maybe my body just reproduce some level of neutrophil, which is the new normal, but below the normal range for the normal people. So anyway, I still kind of having a low neutrophil at the moment, but it's not at the risk of easy getting infection or such. The pneumonectomy, which kind of hurt me quite a bit, besides the short of breath, and I developed hypotension, which my blood pressure dropped quite a bit. Where I used to be 120 over 80, now it's 90 something over 60 something. So that caused me a lot of trouble when I stand up from a sitting position, or if I squat and stand up, and often I kind of get dizzy quite a lot. And so that's something that I try to get used to and manage, but I still don't understand what is the reason behind that. Who can explain that? Why I have the the hypotension after the surgery, which my blood pressure dropped suddenly quite a bit. Anyway, to those pharmaceutical research scientists, I don't know if we have a better agent to replace a cisplanting. Definitely, there's a lot of side effect for that. For whoever is currently using and who plan to be the one that to use that, one recommendation is that you might want to do a hearing base kind of a test, so that you know where your hearing ability is currently. Then right after, probably you can see the effect from the cisplanting treatment. So that's something my ENT doctor recommended me, but it's too late for me. I didn't do that. Anyway, thanks everyone for your time.
Thank you.
Thank you.
So I think this was a record tonight in how, no, seriously, but people had a lot to say. That says
That's
a
good.
lot.
That's good.
We went, it normally takes us about 30 or 40 minutes to go around the room, and it took us an hour and 10 minutes to go around the room. But that points back to what there's a huge need and opportunity. So thank you all so much for sharing your stories. I do want to jump into the topic. I also want to remind everybody to ask questions throughout. Make sure we keep this conversation going. To my left here is Dr. Donald Abrams, who you've heard referred to. I think Jane mentioned his name a couple times. He's an integrative oncologist, immediate past chief of hematology and oncology at Zuckerberg San Francisco General. I remember when it was just San Francisco General. And integrative oncology, UCSF Osher Cancer Center for Integrative Medicine, and professor of clinical medicine at UCSF. On the tables in front of you and on the table outside, there's a full bio that goes through his many, many accomplishments. But not only that, some links that I think are really important and interesting to some videos for some of the work that he's done for you guys to go back and watch later, because we could really turn this into a 6 or 7 part series if we really dug deep and got, into the nuts and bolts of how important integrative oncology is to your care. I'm looking at you because I think you want to say something.
No, I just want to say, I can't stress more what Danielle is saying and what this amazing doctor is going to talk to you all about, because this all goes beyond chemotherapy and radiation and all that stuff. Integrated medicine is huge, and it's there to make you feel better and to make you get through this process much easier. So we're just thrilled to have him here tonight.
And then to his immediate left is Susan Smedley, who is not only the manager here at GoTo of our Grassroots and endurance events, but she is a survivor herself who has been incorporating this integrative type of care in her life for quite a while now. So we wanted her to be able to share some of her experiences and how it has impacted her journey, I guess. I hate calling it a journey. I need another word. Since her original diagnosis. But I want to jump in first and ask Dr. Abrams just to kind of give a high-level overview of what integrative medicine is? What does it mean?
Sure. So first of all, I do want to thank everybody for sharing those stories. I was really impressed by everybody's courage, intelligence, and articulateness. And I must say that I just went to my own primary care provider last week. Pre-retirement, I thought I should check things out. And I quit smoking for the second time 28 years ago. And he ordered a chest x-ray. And I didn't hear about it for 2 days. And scanxiety, I mean, I was absolutely crazy because it didn't appear in the chart. And so I figured, oh my God, so he's gonna, anyway. So your bravery and courage also resounds quite heavily. So integrative medicine is the rational, evidence-informed combination of conventional therapy with complementary therapies. It's relationship-based and patient-centered. When I see a new patient at the Osher Center, I start out by saying, tell me your story. Very similar to the stories you told, and I listen. The average physician waits 17 seconds before interrupting the patient's first comments. So I listen. Actually, we get rated on our performance, and my lowest score is doctor knows my history, because I say, tell me your story. So now I've sort of changed, and when a new patient comes, I read a little bit in the chart, and I say, oh, I see you have lung cancer, and it was diagnosed. So it looks like a little bit, but it's very important for me to hear the story from the person so I understand how it impacts their life. Often I say, tell me your story, and they hand me a sheath of lab results or x-rays. I said, no, that's not your story. Or the spouse starts to tell me the story, and that tells me the story. But you know, it's relationship-based and patient-centered, and it's evidence-informed. Modern medicine is very much evidence-based. Andrew Weil, who's sort of my teacher, always said the degree of evidence should be directly proportional to the potential for the intervention to do harm. So if I say I'm going to give you a new chemotherapy and your hair is going to fall out and you're going to vomit for 3 days and your bone marrow is going to be suppressed, you would like to see some evidence. But if I say eat more broccoli and blueberries and get a massage twice a month, how much evidence do I really need to generate? Okay. You know, so, and how did I get to this? Let me just say that at the beginning of my training to be an oncologist at UCSF, suddenly AIDS came out of the blue, and we didn't know what it was or what to do about it. And I became a champion of alternative therapies when there was no conventional therapy to be alternative to. And then when we got our first conventional therapy, something called AZT, some of you might remember, I said, oh, this isn't very good. So I wrote all the chapters in all the AIDS textbooks on complementary and alternative therapies. And then in 1992, somebody challenged me to study cannabis as a treatment for the AIDS wasting syndrome. And I said, okay, I can do that. I went to college in the 60s. So I fought the government and ultimately won and got marijuana and money to do research, which gave me a strong appreciation of the power of plants as medicine, which then took me to the Telluride Mushroom Festival in Telluride, Colorado, a month after I'd done my first ever jury duty and came home and said, I want to go to law school. But in Telluride, I met Andrew Weil with the white beard, and he described a 2-year online distance learning fellowship you could do with his program at the University of Arizona in integrative medicine. So I said, I don't want to go to law school, I want to do that. So I did, and it changed my life. When I finished, I said, I'm done with HIV/AIDS. What I want to do now is integrative oncology, working with people living with and beyond cancer and helping them to integrate these other modalities into their conventional care. I can't really do that at San Francisco General Hospital, or we do call it Zuckerberg. Because as I often say, for most of my patients, their cancer is really the least of their problems. They're homeless, they have substance abuse issues, mental health issues, or they're undocumented. So I can't really talk to them about eating organic or doing yoga because they have much more basic needs. So I went to our UCSF Osher Center for Integrative Medicine and asked, can I just do a half-day clinic here and see if I like it? And it quickly became my favorite half day. And now I have 2 half-day clinics, and I also do group visits at the Cancer Center. So what I say is, at San Francisco General, I treat cancer, and at the Osher Center, I treat people living with cancer. And I tell them cancer is like a weed, and other people are taking care of your weed, and it's my job to work with the garden and make your soil as inhospitable as possible to growth and spread of the weed. So I'm not really talking about weed killers, I'm talking about fertilizers, and that leads me into a conversation about nutrition and supplements.
Robert, did you have a question before we jump into nutrition?
One I was going to ask when that festival is with the mushrooms, but the
Can you use the mug? I'm sorry,
I can't hear.
for vanity, I took out my hearing aids. So.
Okay, we'll put them back in. I have a lot of bone damage in my spine. So in consequence, I have a lot of pain associated with that. Do the mushrooms help with that?
Mushrooms with pain? Not really, no. And I don't think I should be doing individual consultations, more general questions,
well,
if you don't mind.
I think a lot of people would probably be interested in that.
For that, if you haven't thought of that.
Okay, edibles? And
no,
don't want to talk about it?
Yeah,
okay.
I think so.
All right.
Yeah, we're going to talk about sort of where those things
Don
generally
was the
used.
sheriff of San Mateo County, so just in case.
Yeah. It's legal, so.
Yeah.
Okay.
Well, yeah. Okay.
Okay, nutrition.
So nutrition is pretty important. The Journal of the American Medical Association looks at the burden of U.S. disease from 1990 to 2016, and dietary risks is the #1 cause of both morbidity and mortality in the United States today, surpassing tobacco smoking, hypertension, and not including obesity and low physical activity. If you put all those together, that's an amazing figure. And the CDC suggests that 40% of all cancer in the United States today is related to overweight or obesity. So obviously, nutrition is very important in keeping our weight stable. What I do is I follow the guidelines from the American Institute for Cancer Research, World Cancer Research Fund. They're guidelines for reducing the risk of cancer, but number 10 says for cancer survivors, follow the 9 guidelines above. So #1 is to be a healthy weight, and #2 is a way to do that, and that is to be physically active. The guidelines changed from 2007 to 2018 when they renewed them. In 2007, they said be physically active for 30 minutes a day, which I think is much better. Now it says move more and sit less, which I think is not very useful. And then the next guideline is the first that says anything about food. And in 2007, it said avoid sugary drinks. So I was at the microphone in Bethesda when they unveiled that as a new guideline, and I said, there are sugary drinks and there are sugary drinks. You can drink a cola beverage, God forbid, or a fruit punch, which is probably glucose and high fructose corn syrup, or you can squeeze 3 oranges in the morning. And the response from the podium was energetically, they're all the same. So I had lunch with Robert Lustig, who's the pediatric endocrinologist at UCSF who fights the war on sugar. And he told me when you eat an orange, the fiber slows down the absorption of sugar into the bloodstream. If you squeeze the sugar away from the fiber, it's like drinking a soft drink. So why is that bad? When the body sees that sugar, it responds with insulin and insulin-like growth factor, both of which promote inflammation, and the growth factor is a growth factor for cancer cells as well, to the point where we started looking at blockade of insulin-like growth factor 1 receptor as a treatment for a number of cancers. So does it mean I don't squeeze my 3 oranges? I used to do it every day. Now I just do it twice a week. But I get concerned about my patients who think I have cancer, I'm going to juice everything. I say the diet should be whole foods. We need that fiber. And when you juice like that, those blades are actually destroying some of the plant nutrients that you're trying to get more of. This year, a new guideline says avoid fast foods. So they really called out fast foods. And again, that's to keep weight stable. Plus, foods that are high in fat, refined carbohydrates, and sugar are very satiating, but for a short time, and they encourage us to eat more. So fast foods were called out. The positive guideline is to eat more variety of fruits, vegetables, whole grains, and legumes. And I ask my patients to concentrate on cruciferous vegetables, flowers that grow in the shape of a crucifix. So broccoli, cauliflower, and Brussels sprouts jump to mind, but there are also cruciferous roots, radishes, parsnips, and green leafies, cabbage, kale, collard green, bok choy, and arugula. These all contain a chemical so potent at reducing the risk of cancer that we've started to look at it as chemotherapy. So I believe we can never eat enough cruciferous vegetables. And I eat broccoli, tofu, and rice for breakfast. My other breakfast is mochi, which is just pounded brown rice. Puff it up in the oven, smear almond butter, and put a sweet potato on top of it. Because orange yellow vegetables are very good for you, especially lung cancer. The beta-carotene in those vegetables seem to reduce the risk. That's why they once did a study of beta-carotene supplements, found out that the supplement actually increased the risk. And that is guideline number 8, is to don't use supplements to protect against cancer, but we'll talk more about that. Number 5 says limit consumption of red meat, and it used to say avoid processed meats, but this year they changed it to limit consumption of red and processed meat. And I think that's incorrect because the World Health Organization considers processed meats, bacon, salami, bologna, ham, sausage, hot dogs, anything you put on a pizza, as a class 1 carcinogen, no doubt about it. And those processed meats are contributing to lung cancer diagnoses. So red meat, I don't believe beef or pork are ever going to be clean, and the only red meat I'll eat is lamb, because I picture it on the hills of Sonoma or New Zealand running free. And I only eat lamb maybe once a week on Sunday. I'm pretty much vegan until dinner time, and that's when I eat animals. Because I think as a culture, we eat too many animals. Those are saturated fat. And another animal product I'm not particularly fond of that's not in the guidelines is dairy. There's no other animal that drinks another species' milk. But no other animal drives a car or goes to college either, so that's not a very good argument. But no animal drinks milk after they've been weaned. And by the age of 3 or 4, we lose the ability to digest the sugars and the proteins in dairy. We make a big deal about fat, low fat, no fat, 2%. It's not the fat. If you want a dairy product, butter is best because it's mainly fat. We talk about lactose intolerance as if it's a disease or a disorder, when in fact it's the norm. And the ability to digest lactose is a genetic mutation on the 2nd chromosome found mainly in Scandinavians who needed to digest reindeer milk in times of freeze. The rest of us, especially Asians, are all lactose intolerant, and we don't know until we stop. So then people always say, what about yogurt? So yogurt, the bacteria have already digested the sugars and the proteins. So if you need a dairy product, butter, because it's mainly fat, or yogurt or kefir, as long as they're not artificially flavored, artificially colored, and with added sugar.
What is kefir?
Kefir is liquid yogurt, yeah. So sugar is the number 1 no. And my colleagues at the Cancer Center say to me all the time, why do you tell all of our patients that cancer loves sugar? And I say, what's a PET scan? How many here have had a PET scan? And what do they inject you with? Radio-labeled sugar. And where does it go? To the cancer, because cancer needs sugar for energy. It doesn't use oxygen. So sugar is the number 1 no. Now, the last guideline that I'm going to touch on nutrition, unfortunately, is about alcohol. It used to say in 2007, if consumed at all, limit alcohol to 2 a day for men and 1 a day for women. And I reached an age about 5 years ago where I can't tolerate alcohol anymore. It disturbs my sleep, and in the morning I can't even look at myself in the mirror. And so I just stopped drinking, and it's amazing how mainstreamed alcohol is in our culture. My little brother's a diesel mechanic in Detroit, and he said, oh, Donald, if you go out with people and don't drink, they think you're a recovering alcoholic. So they changed the guideline this year because they appreciate that 6% of all cancer in the United States today is related to alcohol consumption. And it says for cancer prevention, no alcohol is best. So that's nutrition.
So I have so many questions.
Okay. Yeah, what do you want to say?
So, okay, so when we're talking about nutrition, you're talking about a lot of these, like kefir, I didn't know what that was, and some of the other things. I loved the crucifix sort of analogy with it, because that helps me.
That's where the word comes from.
Yeah, I get it. That helps me understand what kind of vegetables are. So when we're working with the patient who maybe is on chemotherapy and it's affecting their taste buds and their appetite and like all of those things, what maybe are the recommendations there when it's really about what they're tolerating versus to keep weight on.
You know,
versus
and
what
the
they
American
need.
Cancer Society used to say, if you're getting chemotherapy, eat angel food cake and milkshakes. And I said, no, that's wrong. Rebecca Katz is a dear friend, and
She spoke here.
She writes Cancer Fighting Kitchen, and she has FASS, F-A-S-S, fat, acid, sugar, sweet, and sour. And she tells you if food tastes like cardboard, add a drop of this, the maple syrup, or the lemon. And her fast, she has it as a postcard too, so I give it to my patients so they can put it up in their kitchen when they're getting those taste disorders from their chemotherapy. But that's, I think, the best thing to do. I mean, you know, I tell my patients, these are my guidelines to keep your soil as inhospitable as possible to growth and spread of the weed. But if you go out and you're eating berries, for example, that are not organic, you're not going to fall over dead. So heavily pigmented fruits, by the way, and apples, particularly good for lung cancer. Quercetin in the apples. Yes.
I have a question about the colored yogurt. What if berries are in the yogurt?
Yeah,
Does that count as a color?
Yeah, I would put your own berries in, because if you look at those yogurts that have berries, so when I say no sugar, if you look on the nutrition facts box on any processed foods, it's okay to have sugars in the nutrition facts box. That sugar fuels our brain. Where I don't want to see sugar, and a nickname for sugar is in the ingredients list. Sugar attached to fiber is fine, eating fruit. We should have 4.5 cups of fruits and vegetables each day, more vegetables than fruits.
Jennifer.
My question is quickly about meat. I know that I really looked into nutrition when I was first diagnosed, and I hired a woman by the name of Jan Wallace.
Oh, yeah.
And she had blood work, special blood work done, and gave me all kinds of supplements to try. But she said if you're going to eat meat, to eat pastured eggs and pastured pork and pastured chicken, and only eat grass-fed organic beef and lamb, and eat it sparingly. And so that's what I'm doing. And you're saying you're eating it just once a week, or you're
red
only
meat. I eat a lot of deep cold water fish, salmon, black cod, albacore tuna, herring, mackerel, and sardines. Those are the ones richest in the omega-3 fatty acids, which are anti-inflammatory and a little antidepressant. The problem with a lot of animals nowadays is what we feed them.
Right.
That's what's wrong with farm-raised fish.
Right.
Cattle that are not fed what they usually eat. So they make fat rich in omega-6 fatty acids, which promote inflammation. But red meat is also a rich source of iron. And I see many cancer patients say, oh, I'm anemic, I'm going to take iron. Iron actually feeds cancer if you're not iron deficient. And then the other thing about meats, besides the nitrates in the processed meats, which are carcinogenic, we love to barbecue. And barbecuing creates heterocyclic amines, which are also carcinogenic. So that's the issue with meat. Chicken and eggs are really the most pro-inflammatory foods out there, not only because of what we feed them, so they make fat rich in omega-6 fatty acids, but they themselves are a rich source of arachidonic acid, the precursor to prostaglandins, the chemical mediators of inflammation. So poultry, which I eat, should be organic. And eggs, which I don't eat, should be organic omega-3 eggs. I only eat 1 egg a year at Passover when we dip them in salt water. This is being broadcast around the world. They give me terrible gas. And they are associated with prostate cancer.
Wow.
So I don't eat a lot of eggs. The average American eats 300 eggs a year. I find that amazing.
Yeah, interesting.
Okay.
There's a lot of big words being used around. It's like just talking about cancer when you first learned you had cancer, right? And they'd use some of those big words. So we talked a little bit about sugar. And obviously, we know that that when you get your PET scan, they inject you with a sugar-based, because it binds to the cancer.
Yeah.
Does binding to the cancer, sorry, let me step back. Does it just bind to the cancer, or does it cause cancer to grow? Because there's a lot of controversy in this area.
A PET scan does. It's people that are eating sugar all day long. You should watch the movie That Sugar Film.
Yeah.
It's an Australian movie by a guy who doesn't really eat sugar. And it's basically Supersize Me, if you remember that, for sugar. The average Australian consumes 40 teaspoons of sugar equivalents a day. So this guy decides he's going to eat 40 teaspoons of sugar equivalent a day without eating junk food for 6 weeks under the supervision of a physician. And at the end of 6 weeks, he's gained weight, waist circumference, and he's developed a fatty liver in 6 weeks.
Yeah, that does not surprise me at all. I just wanted to make clear because we get a lot of
No, PET scans are really
questions.
important. They've changed our treatment and diagnosis.
Of course,
Yeah.
but people saying, oh, I can't have a piece of cake at my grandson's 5th birthday because the sugar is going to make my cancer grow. And I think that...
Again, you can eat off the menu every once in a while, but I think if you practice a anti-inflammatory lifestyle, then it's a better thing, you know, if you can.
What about drinking sugar? Drinking sugar in wine.
Drinking sugar.
Well, there's sugar in wine.
Oh, yeah, but it's not added sugar. Yeah.
No.
Yeah, no. For me, the best beverage is green tea, by the way. I drink 5 cups of green tea every day.
Okay.
Green tea second only to cruciferous vegetables in the potency of its cancer-fighting chemicals.
Okay.
Yeah.
So adding sugar is the devil.
Sugar. So I demonstrate 2 bars to my patients with regards to how to read a label. One is a Go Lean bar. I won't mention the name, but the first ingredient is brown rice syrup, which sounds like sugar, followed by the ubiquitous soy protein isolate, then evaporated cane juice crystals, and then crystalline fructose. And that has 13 grams of sugar. I don't worry about sugar in the nutrition facts box. The other bar has 16 grams of sugar, but its ingredients are dates and cashews. Get it? So that's the difference. If the sugar is attached to the fiber, then it's fine.
So you talked about these 9 guidelines.
Yeah.
Where can
10.
people... 10?
Yeah.
Sorry,
Well,
I wrote 9.
Number 10 is for cancer survivors, follow the 9 guidelines above. It's the American Institute for Cancer Research, World Cancer Research Fund, and they have a website, and they're good.
Great.
Yeah.
So then one of the other things I wanted to... Does anybody have any questions before I keep... Go ahead, Jennifer. Oh, and Fred has a question.
I have one other question about juicing. I mentioned my husband juices for me every morning. It's something I've been doing for a year and a half.
I heard that,
but it's all green juice.
Yeah.
And it's kale and it's ginger and it's a whole lemon with peels and so on. And I'd have it every day. And I know the fiber's best, but I also eat a lot of fruits and vegetables during the day. But that is something that I've kind of stuck with, and I feel like it's a lot of good.
You look like you're doing fine to me. So if it's not broken, don't fix it. But in general, I do my oranges twice a week and 1 carrot juice a week, and I think we need that fiber for our colons. Yes. Yeah.
Fred?
Yes, what about probiotics? How do they fit in?
So probiotics are present pre and probiotics are present in yogurt and kefir, sauerkraut, other fermented foods. I also take a probiotic capsule. People on immunotherapy, they found, who take probiotics don't do as well as people who don't take probiotics. So if you're on an immunotherapy or a candidate for an immunotherapy, I'm not exactly sure why that is. They also showed that people who eat more processed foods and drink too much sugar don't do as well. So it probably has to do with your microbiome on immunotherapy. There's a lot of research on how the microbiome, the organisms in our gut, affect our responses to immunotherapy.
But doesn't that contradict the initial research that was done on probiotics?
There's not a lot of research that's been done on probiotics. It's more it's not randomly assigned, this half of the room take a probiotic and this half not. They ask people what they take and they do sort of a retrospective observational study. So it's not as strong evidence, but it suggests, and the probiotics I like are refrigerated usually and have lactobacillus and bifidobacterium as the 2. And anybody who's had chemo, which I think is a very potent antibiotic, I think should take probiotics. But again, I would be cautious in people who are going to get immunotherapies.
Okay, thank you.
Interesting. Dawn, I see you looking for a microphone.
What about doing combinations if you're on immunotherapy and chemotherapy?
Then I would avoid the probiotic.
Okay.
Yeah.
And one other question, you had mentioned cannabis when you first started your presentation. Have you heard anything about, because I don't drink alcohol, but I do take cannabis, CBD, THC gummies when I'm on steroids and to help me sleep. But I've heard that when you're on immunotherapy, it's not a good idea to use any type of cannabis.
Well, that's another observational retrospective study that they did in Israel. They had some patients with lung cancer and some patients with kidney cancer, and they found that the people who use cannabis, excuse me, let me do that for a minute. They found in the study, which was again a retrospective analysis, that the people who used cannabis while they were getting their immunotherapy had a less robust response to the immunotherapy, but the survival was the same.
Interesting.
So supplements, probiotics I like. The only blood test I measure, Gene Wallace measures everything, I measure vitamin D. Because those of us who are over 50, overweight, or heavily pigmented are vitamin D deficient for the most part. And people with low vitamin D are at greater risk for cancer, and people with cancer whose vitamin D is low don't do as well as people whose vitamin D is normal. So I measure the vitamin D test, and I supplement to bring it into the range of 40 to 50.
How do you feel about giving vitamins by a pill versus liquid? Do you
So
absorb?
it's a good question for vitamin D because vitamin D is fat soluble, so it needs to be taken as a liquid or a gel bead and not as a white powder complex to calcium. Many people take a combo vitamin D calcium. Vitamin D should be a gel bead or a liquid and not a white powder. But calcium is another thing I like because I ask people don't do dairy, and dairy's our major source of calcium. Plus, if you're over 50 and if you have a cancer that might like to go to bones, you want to keep your bones strong with vitamin D, calcium, and resistance activity, including yoga. So vitamin D, calcium, and magnesium, because magnesium sort of balances the constipating effect of the calcium. And then fish oil, as I mentioned, omega-3s. Another study that was not randomized found that lung cancer patients getting chemo, taking fish oil, did better, got more chemo, and got better responses from the chemo than the group of patients who chose not to take fish oil. So I like fish oil, and I like medicinal mushrooms. I mentioned that Telluride Mushroom Festival, my life turned around when I met Andrew Weil. Mushrooms, when we ingest them, by the way, all mushrooms must be cooked. Slicing white buttons and throw them in a salad raw is a no. White buttons have a cancer-causing compound. So all mushrooms must be cooked. But mushrooms...
I love uncooked mushrooms.
Mushrooms sort of pretend that they're bacteria, or our body thinks that they're bacteria when we eat mushrooms, and it mounts a non-specific immune response, which may also work against the cancer. So I like mushrooms for most of my patients, but not patients on immunotherapy again, because that immunotherapy might be so effective, I don't want to have the mushrooms immune enhancement interfere with the immunotherapies. So I don't recommend mushrooms to those patients.
What about collagen?
What's that?
Collagen.
Collagen is for joints. I don't think it has much to do with cancer. I take it for my osteoarthritis.
Well, bone cancer that has spread to the bones.
Okay, yeah, I think more of joints for collagen than bones.
Rick, and then Jennifer, you had.
So you were talking earlier about yogurts, and you said not liquid yogurts. Are you talking about, like, to name a brand, Yakult or something, like the little bottles that you drink?
For yogurt?
Yeah, you were saying yogurt was good, but not liquid yogurt.
No, I said she asked me what kefir was, and I told her it's liquid yogurt.
Yeah.
Oh, okay, so that's fine too.
Yeah.
Gotcha. Thank you.
Jennifer?
I just really wanted to make sure when you said fish oil's good, is it okay for immunotherapy as well?
Fish oil is okay for immunotherapy.
Yeah, for either chemo or immuno.
Jane, and then Don will come to you.
I have a question on the green tea or any other tea. I know you highly recommended that I take green tea, but Is there a preference between the loose leaf green tea or the one in the sachet?
Do you hear what she
Is
said?
there a preference
In a
between
tea
the
bag.
loose leaf green tea or the?
No.
It doesn't
For me,
matter.
it's easier, as you know, because I drink during my clinic, to have a bag.
They
A lot
have
of
a
people
bag.
say, I don't want caffeine. Caffeine is not good for me. So rather than buying decaffeinated green tea, which might remove some of the active chemicals that we're trying to get more of, if you brew a bag for 2 minutes, dump it out, and then rebrew the bag, most of the caffeine has come out in the first 2 minutes. So that's a little trick for decaffeinating your own green tea.
Is there any green tea that you recommend? Because when I was doing my research, there's matcha, there's other stuff. But any regular green tea is okay in a tea bag?
Any green tea is okay in a bag?
That says green
Or do
tea.
you recommend a brand?
So tea is the name of the beverage brewed from the Chinese camellia, or the Camellia sinensis, and it's graded on how oxidized the leaf is before the beverage is brewed. White, green, oolong, black, and pu'er. And the only two that have the cancer-fighting chemicals are white and green.
Green.
So I usually recommend an organic Japanese,
Organic
because I don't think
Japanese.
anything from China is actually organic with their air issue.
Okay. Thank you.
Great. Don?
I just want to make a comment on vitamin D3. When I was first diagnosed, I used to post a lot about that. And I had my NGML tested when I was first diagnosed, and it was 28. And so I started superdosing with D3. And I did, for years, I did 15,000 IUs a day. And I got my vitamin D levels up to 85. But a lot of people that responded to the post I would post said that responded that they were very low on vitamin D when they were diagnosed with cancer.
Yeah, you have to be careful how much vitamin D3 you take, because it can increase the calcification of your coronary arteries and your aorta. And people don't recommend more than 4,000 international units of D3. For people that are very low, I do D2, 50,000 international units once a week for 8 weeks.
I'm
back down to 5,000.
Okay, yeah.
Amy has a question online, and then we'll go to you, Casey.
Yeah. We have a question about melatonin and what you think about it and what strength.
Melatonin?
Yeah.
Melatonin, I think, is fine for sleep. When I take it for sleep, I get a little bit groggy and cranky. So Andrew Weil said, I'm taking it wrong. I shouldn't swallow it. I should take 1.5 milligrams instead of 3 and put it under my tongue at night. And then I fall asleep better. I know that there's an Italian investigator who tells people they should take 20 milligrams a day because it's good for brain, lung, and breast cancer. But he's the only one who's ever demonstrated that. It's never been reproduced. And I don't understand how people could walk around taking 20 milligrams a day. But people say they ramp up slowly and they don't have any effect. But I don't think it cures cancer.
Casey?
I think with all these new health trends, there's now some replacements, mainly nut yogurts, nut cheeses, and then there's coconut milk, coconut ice cream. Now there's stevia going into sugary drinks. What's kind of the general concept around all these new additions to food?
So the question about what's a good sweetener, is that?
So you're just basically talking about like what
New
are the
replacements.
replacements? So if it's coconut milk instead of
Yeah,
You know.
Nut
so instead of
yogurts, nut
dairy,
cheeses.
I personally use rice milk. Soy to me is also okay, but it tastes a little too green for my taste. There's cashew, hemp, almond. There's many different types of milk, coconut as well. Stevia, if you need a sweetener, stevia is probably one of the best because it's natural. People say, what about honey? I said, if we were meant to access honey, it would probably be easier to get to. Grade B maple syrup, which is not so easy to get to either, is probably a good sweetener. We do that for Thanksgiving and Christmas sweet potato pie. But otherwise, if you stop doing sugar, you don't really miss sweets too much. The New York Times had a great editorial, January 1st, make 2020 your year of less sugar. And they recommended, what I recommend to my patients, just for 3 weeks, stop sugar. I say dairy, sugar, and red meat, and just see how you feel.
Amy?
We have another question regarding the difference between red and white. Do you see a difference, or do you have a preference?
Red and white.
Wine.
Yeah, so again, as I mentioned, fruit should be heavily pigmented. I didn't say that I don't believe much in homeopathy, but I do eat my whole apple every day except for the stem. Because in homeopathy, they say take a little bit every day of what you're trying to avoid. and apple seeds are cyanide, which is death. And the queen mom ate her whole apple every day and lived to be 103. And I think the new one's doing it too because she looks pretty good. I don't think ancient men threw out their apple core or their pear core. Similarly, if you find a grape with a seed, that bitterness in the grape seed, that's the grape trying to protect itself from a predator. And we now know that grapeseed is good for breast, colon, and prostate cancer. So if you're eating grapes, red with skin and seed, and if you drink alcohol, red wine would be the best beverage. Green tea is better.
So I'm feeling like my head is spinning right now, and I know I have so
We
many
have to
questions.
do some cannabis, though.
Yes,
don't we?
we're gonna get into the
Okay,
cannabis.
but we also have to have.
And we're gonna. Yes, I want.
Yeah.
I want Susan to talk about how she's integrated some yoga and some breathing and Reiki into. Particularly, somebody was talking about anxiety and some of the anxious things that come along with it. So I do want to get to that. I also want to plug again, and you brought it up, Rebecca Katz.
Yeah.
She's got several cookbooks out there. I think she was on her second. We had very early started doing the living room. We weren't even filming it yet when she had agreed to come in. It was right after the Cancer Fighting Kitchen and before the next, whatever the next one was. And we actually cooked a bunch of food from the cookbook.
The recipe, yeah, we
so
did
that
the
the patients
recipes.
could,
Yeah.
and it was great, right? So, so I highly, highly recommend that, particularly if you're in treatment and you're having taste issues and things like that. I also feel kind of like it's like a Japanese subway trying to, like a map of the Japanese subway, trying to kind of navigate all of this.
Yeah.
So any
Fast.
resources, this will be my last question sort of in this nutrition space, that patients, their loved ones, caregivers can go to learn more about what you're talking about, whether it's some of the supplements, the foods and what works and what doesn't, anyway, you know what I'm saying. Where's a good place to go to get that?
I like my website, Abrams. If you Google Abrams Osher, O-S-H-E-R,
Yeah.
I have 4 videos at the bottom of the page.
It's on the website link is on the piece of paper on your desk. So there are videos.
And isn't most of this obvious? It is to me now, hearing you say this. We kind of instinctively know when
we just don't do
doing
it.
bad, right?
Yeah, I see a lot of patients come in follow-up and they have a little Donald on their shoulder every time they do something wrong. I said, I'm not a priest. Leave me alone.
Exactly.
You don't need to confess.
Right, exactly.
Okay, so I want to jump into what seems to be not just a national but a global question that we're getting more frequently, particularly over the last couple of years, and that is around the role that cannabis may or may not play in the treatment of cancer. Can you talk a little bit?
Yeah, so I've just written last week, or this week, JAMA Oncology published Can Cannabis Cure Cancer?
Can you tell people what JAMA is?
Oh, Journal of the American Medical Association. One of the oncology section of it published my viewpoint that I was invited to write, Can Cannabis Cure Cancer? And the answer is no. But I also wrote a piece, Should Oncologists Recommend Cannabis? And I'm a very strong proponent of cannabis for symptom management, for pain, for nausea, for loss of appetite, for sleep, for anxiety. It's, I can recommend one medicine instead of writing prescriptions for 5 or 6. The concept that it cures cancer comes from my friend Manuel Guzman, who wrote the article with me, has a lab in Spain where they study the metabolic effects of cannabis. So they add it to brain cells, which are the most metabolically active cells. And they decided maybe they could do it faster if they did a brain tumor. So they grew up a rat brain tumor and added the cannabis and everything died. So they said, oh, we must have made a mistake. They did it again, everything died. They said, maybe it's bad cannabis. So they went back to the normal rat brain and everything lived. So the brain has this high density of receptors for cannabis chemicals, and that's why when you add it, it kills brain cells. So if cannabis is going to work for any cancer, it's going to work for primary brain cancers, but there's no evidence that it does. The other thing that there's no evidence for is CBD, which is all over the place. Sanjay Gupta just did Weed 5, where I was sort of heavily featured because I believe CBD, now a $23 billion industry, is way out of proportion to the evidence that it does anything.
I don't know what's...
It seems to work. It's been approved for childhood seizures. We did a survey of people using CBD-dominant products in dispensaries in San Francisco, San Diego, and Chicago, and they were mainly middle-aged women, upper class, using it for pain, sleep, and anxiety. And they all said 8 out of 10 effectiveness. Now, that doesn't count the 400 people who didn't fill out the survey because CBD didn't do anything for them. I believe THC, tetrahydrocannabinol, the main psychoactive component of the plant, is the medicine. And CBD is probably present in the plant to modulate the effects. If you eat cannabis, it takes 2.5 hours to reach a peak concentration in the blood. If you inhale it, it's 2.5 minutes. If you eat cannabis, the THC gets converted in the liver into an even more psychoactive metabolite. So I see a lot of older women, particularly with cancer, who think eating is good and inhaling is bad. So they go to the dispensary and they're told, only eat a quarter of the cookie. And they do and nothing happens, so they eat another quarter and nothing happens, so they eat the whole cookie. And then they call me 3 days later after a visit to the emergency room saying, I'm never going to do that again. So I say, if you want more control over the onset, the depth, and the duration, inhalation is better than ingestion. What about lung cancer? I was a member of the committee of the National Academy of Science, Engineering, and Medicine, and we said that there is no evidence of an association between cannabis use, i.e. smoking, and lung cancer. In fact, Donald Tashkin in Los Angeles has made his whole career studying the potential harmful lung effects of cannabis and did a study of 1,500 people with upper aerodigestive lung, esophagus, head and neck cancer in Los Angeles, and found that people who smoked a little cannabis had less lung cancer than people who never smoked anything, because it's an antioxidant, anti-inflammatory, and may have some anti-cancer activity. So my lung cancer patients are always afraid of inhaling cannabis. I say, get a nice vaporizer, not a vape pen. I'm an oncologist. I'm very conservative. I know the long-term effects of inhaling a plant, but not of an oil. And it turns out I'm probably right, because vaping is not good for your lungs. But vaporizing or using a bong, delivering that stuff right to where the action is, I think it may be beneficial.
Could you tell us why using cannabis would be better than pills like oxycodone and things like that?
Oh, because cannabis doesn't have the addictive potential of oxycodone and things like that. But I want to hear from her, don't you?
Yeah, I do too. Yeah, go ahead, Dawn. I think you have a question. We're going to probably go over
Just
by
a
at
quick question.
10 minutes.
You said edibles take 2.5 hours to get into the system.
Yeah.
So if I was taking an edible, it's that THC CBD combo with melatonin. And I only take it right before I go to bed, and I'm more doing it for sleep. Then that's not an issue if it takes a little
Right.
longer.
If you're trying to increase your appetite or decrease nausea, I mean, if you're going to get chemo, I wouldn't take a gummy. First of all, gummies are all sugar. I don't want to say anything, but I wouldn't do a gummy right before you walk in. I would probably go, I live in San Francisco, and my hospital, it always smells like skunk.
Yeah. Yeah.
You know what I mean?
I do it for when I'm on steroids. I'm on steroids 3 days a week, so I do it to help me sleep.
Yeah. Are there, I know, because there's a lot of, there's dispensaries out there right now where you can go online, really without having any knowledge at all. You can buy whatever you want and the guy will deliver it to your house in 30 minutes, so.
He'll have a trench coat on, though.
Yeah. But I just, it's so creepy. I think.
It's weird. It's so weird.
I think, is there a concern about its X milligrams of THC versus, do you know what I'm saying? Especially when it comes with a lot of these edibles, because it's the concentration.
Again, I'm an oncologist, so I do like evidence, and there's not a lot. I've done most of the research on inhaled cannabis plant in the world today.
Yeah.
There's not a lot of evidence out there. So, patients always ask, what's the right ratio? 1 to 1, 1 to 2, 2 to 1, 4 to 1. There's no answer to that question because nothing's been studied and nothing's been published in the literature.
Yep.
So I tell my patients, go to the dispensary, tell the bud tender what it is you're trying to treat, and ask them what works best, because they've been on the front lines for 20-some years working with patients, and they know what might work best for anybody's. I also work with these 2 pharmacists, graduates of UCSF, and they have a concierge cannabis service where you get in touch with them, tell them what meds you're taking, what symptoms you're trying to treat, and they will get you a product without you having to go to a dispensary. So that's probably the wave of the future as well, to get pharmacists more involved in this whole field.
So on the second page, there's a couple of different documents on the tables in front of you, and if there's not enough, I'm happy to make more copies if you'd like some. But there are links that point back to videos specific to some of the things we've talked about tonight: nutrition, supplements, cannabis, and there's a fourth one.
Integrative Oncology.
Yeah. Just a general overview of integrative oncology. So please take one of these if you want to go back and have more information. But
and I always tell patients, if you've watched all my videos, you don't really need to come see me, because what am I going to say? You've seen it all.
So with that, I want to go, because Dr. Abrams did touch on something that I was saving for Susan, and that is to talk a little bit about exercise. He mentioned 30 minutes, I think, a day is what they're saying, and for lung cancer patients in particular, that can be a challenge because their lung capacity is compromised, right? And so getting any sort of what one might deal real exercise is not always an option. But Susan has some information and some things that she wants to share with us about how she's incorporated a more low impact type of exercise and the benefits of it. And share, will you want to share it?
Yeah. So I first came into looking at the world of mind, body, and wellness in my 20s, actually. I had been working as a social worker on the front lines, worked at a rape crisis center in Chicago, and talk about stress, was carrying the beeper, the whole deal. That tells you how long ago it was. And over the course of a couple years, I started having different body symptoms, right? I was basically burning out and didn't realize it at the time. By the time I was 25, I was in total, what they would call now, adrenal fatigue. I was diagnosed with chronic fatigue syndrome and basically was told, we can give you antidepressants and that's about it. Well, I changed my garden. I pulled back from doing that kind of work, and my symptoms didn't get better, and actually I started having breathing issues and wheezing, and had x-rays. They came back clear. Fast forward a couple of years, when I was pregnant, I coughed up blood, and that was the first sign that something might be off. But X-rays kept coming back clear. Throughout this period of time, I started looking outside of allopathic medicine and started seeing an acupuncturist and Chinese herbalist, and she was really treating me as a person. I had a couple of diagnoses, but she really wanted to know my story, wanted to know when all this had started, and follow the trail that way. And from that point forward, I really credit her with saving my life, because when the inhalers weren't working for my asthma and some of the other things that were prescribed for me, she started doing cupping on some points on my back. And I credit that with saving my life, because I started coughing up copious amounts of blood. And then we were sort of forced to look past the stigma of, I'm 32 years old, I'm healthy, and she can't have lung cancer, to where they did a bronchoscopy and found that I, in fact, had lung cancer. And
they never took a CT?
Never took a CT, no. So this was 23 years ago. I'm incredibly lucky, obviously, to be here. And the interest that I have had, certainly back then, it led to an early diagnosis. But it also never left me that it was very much connected to the stress that my body and my spirit was under. You know, I was basically living in a state of constant fight or flight, certainly professionally. But then, you know, previous to that, I had had a pretty traumatic childhood. So when you look at, you know, the previous 10 years, and then I started developing symptoms, I read Louise Hay's book, Heal Your Body, where she has found the body of thought that certain symptoms or diseases are connected to emotional states and experiences. And before I was ever even diagnosed, I started looking at that book. So when I was diagnosed, it didn't completely shock me because I saw that it was sort of part of my larger life. And I didn't see it as being blaming myself, like, oh, I caused this. I saw it as I'm not just a group of symptoms that needs to be treated by someone outside of myself, that I can participate in my own healing, you know? So I didn't just say, I'm gonna heal myself. Don't get me wrong, I went and had a thoracotomy and, you know, followed doctor's orders. At the same time, I looked at what can I be doing to tend to my own garden and to listen to my own wisdom. And I have continued to follow that trail forward because we shouldn't be living from scan to find out, can we live? We absolutely can live. And as I have progressed, I've come to yoga. And, you know, after having the better part of one lung removed, I couldn't run anymore and I couldn't be an athlete until a friend of mine said, Susan, I'm a breast cancer survivor. Come join Team Survivor and let's do a triathlon. And I kept telling myself I can't do it. And the truth is, I could do it. I was slow. I trained. We did a sprint triathlon, and I just went slow. And I finished that race, and I was a different person after that because I changed what I was telling myself I could and couldn't do. And I know we have a marathoner here that she's training for a full marathon. Yeah, you know, what we're telling ourselves we're capable of. And it doesn't mean you have to run a marathon, certainly not as fast as Jason did, but we get to decide what we want to do. And it may not be your thing to run a marathon, but let's look at what we can do. And yoga has really spoken to me on a variety of ways. From a trauma perspective, I mean, getting a cancer diagnosis explodes your life and explodes the lives of everyone that loves you. And, you know, there are stress hormones that are connected to living with this sort of diagnosis. And every time we're waiting for a scan, that gets reactivated in our bodies. And so we need to get that out. And one of the ways that we can do that is through intentional breathing. And if we have time, I would like to actually demonstrate that to you so you all leave here with a tool that you can use anywhere at any time, including in the infusion chair, including as you're driving, when you're standing in line somewhere. So are you all game for that, to walk away with a tool? Okay, great. So what I'd like you to do is sit forward and just move around a little bit. We've been sitting for a while. And press your feet into the floor, okay? And if you feel comfortable, I invite you to either blink your eyes closed or send them down on to the floor in front of you to find what we call a soft gaze. And what we're doing is we're starting to bring our awareness inward a little bit. And I invite you to take your hands and place them on your low belly. And what we're first going to do here is just press your low belly out and then draw it back in. So really send it out on an inhale like a big fat belly, and on your exhale, draw it back in. And let's start to slow down our breath here, inhaling through the nose as we press the belly out for 4, 3, 2, 1. Exhale, draw it back in for 5, 4, 3, 2, 1. Send the crown of your head up as you inhale, pressing the belly out. Exhale, let your shoulders drop as you draw the belly in. Take several more with your count, really drawing breath up your straightened spine. Exhale, drawing the belly back in. Several more here. Okay, last round here. And then slowly blink the eyes open. Maybe move around a little bit. So there were a couple key points to that breath. Number one was you want to not be slouching, right? Because we want to open up the chest. We want to send the crown of the head up to straighten the spine, okay? We also want to inhale and exhale through the nose if you can, okay? And then we're sending the low belly out. What we're doing is we're working our belly like a bellows, right, with a fire. And what we're trying to do here is to activate the vagus nerve. And it's the largest nerve that runs throughout our body. And when we move our belly out and in, we're activating the vagus nerve. And what that does is it sends a signal to the brain to activate the parasympathetic nervous system, which is the rest and digest nervous system. The opposite is the sympathetic, or the fight, flight, or freeze. What we want to do is we want to get out of that state of anxiety, of fear, of gripping. And we can't talk ourselves out of that, you know, because it's a mental state. The answer is in the body. So we use our breath to basically hijack the nervous system to click into the calm, and it releases the calming hormones. I mean, do you feel any different from before we did the breathing? And that's the power of those calming hormones. And the way that we do it is through the breath. There's a lot of different breath practices that you can find online. There are several resources available. There is a whole world, 5,000 years of yoga and pranayama, or breath practices, that are designed to help people navigate life and to use the body to help clear the mind. And we don't have to be a slave to our thoughts. We are not our thoughts. We are not our symptoms. We are not our diagnoses. We are far more than that. And when we're able to use our breath, we create that pause to then recognize that we are not our thoughts. So I know we're running late on time, but I wanted to give you one practice that you can do anytime. And I encourage you to educate yourself about other practices that are available to you and try different things. Because it doesn't have to be up to something outside of yourself. You have the power to calm your mind and calm your body. and really tend to that garden.
And Susan, there's another, there's two separate documents on the tables in front of you. One, the other one, we already talked about one. The other one, Susan kind of outlined some of the things that, that she's privy to that have been helpful for her. So anything from online videos, like she said, to mobile applications and those sort of things that you guys can check out on your own if you're interested. This has been a really fascinating conversation to me. I don't know that everything is going to resonate with everyone in the room, but what I'm hoping, or anyone or everyone online, but what I'm hoping is that bits and pieces that picked up will resonate with you, and you will want to dig deeper and learn more about how some of this integrative type of medicine, if you will help you on a personal level in a way that works for you. So I want to give a huge thank you to Dr. Abrams and to Susan for coming and talking with us today about what is going on in this space right now, today, in real time, and how it can benefit you. Again, please don't hesitate to take those documents off of your table. I'm going to go through some housekeeping and some up nexts. We have an event, our very next event is February 9th, I put my glasses on for this, in Southern California is our 5K, our Phoenix, well, it's not really Phoenix, but
Don't you have one tomorrow?
I'm going to get to that, to the living rooms. These are just the 5Ks.
Okay.
Our Arizona 5K is on February 15th. So if you know anybody in the Southern California, Arizona places who, or if anybody's watching from there who wants to participate, gather together with our communities in those spaces and spend the day together, please don't hesitate to reach out to us here at GoTo and sign up for those events. We have a living room tomorrow night. Some of you may have noticed that Michelle's not here. Our next living room is tomorrow night in Atlanta, Georgia. So Michelle is out there, as is our Senior Director of Science and Research, Jennifer King. They are meeting with a multidisciplinary team from Emory to talk about biomarker testing, why it's important that you know your tumor, not only at diagnosis, but at progression and beyond. So tune in tomorrow night if you guys are interested. It will be on Facebook and YouTube Live, just like this is, but it will be Eastern time, so it'll be 2:30 here for anybody who wants to sign in and watch that. And then next month, we've got Jonathan Reese coming back from UC Davis. We don't have pinned down a title for a topic yet, so I'm keeping it a secret until we announce it. A huge, huge thank you again to Dr. Abrams, to Susan, to all of you in the room, to everyone online. You, like I say every month, are why we do this, why we put this on. So thank you for coming out and being a part of it, for engaging, asking questions, and really allowing other people who can't be live with us here in the room to participate in a meeting like this, to ask questions either live night of or go back later and watch post-live. It means the world to all of them, and certainly to all of us. None of this would be doable without Peninsula Television. So a huge thank you to Peninsula TV. If you live in the area, Channel 26, this will be playing over and over for the next month, periodically, as do all of the living rooms.
Usually about 4 in the morning. But I'm usually up, so if you're watching it, give me a shout, and we can talk you through it.
I want to be sure to thank our sponsors: AbbVie, Amgen, AstraZeneca, Bayer, Boehringer Ingelheim, Bristol Myers Squibb, Celgene, Dignity Health, Foundation Medicine, Genentech, Lilly, Medtronic, Merck, Novartis, Takeda, and Tesaro. Thank you all for your support, and we will see you guys next month. Please come and get some dessert, and if you didn't get a chance to eat, come and get some
cold chicken
food. Thanks, everybody.
Oh, I'll be brave if you're brave. I'll be brave, but only if you're brave. And it could be just you and me. We'll be family. Just wait and see. So I will fight if you'll fight. Yeah, I will fight, but only if you'll fight. Oh, we can make it through this like sailors in a tempest. Like sailors in a tempest together. And it could be just you and me. We'll be family. Just wait and see.